Cyclist sir, we are live.
Good afternoon, everyone. I'm Dr. M. Ganasai Krishna, doing fellow in rheumatology and immunology in CRICR Bangalore. I'll just be telling about ankylosing spondylitis today, as it is observed as World Ankylosing Spondylitis Day. The topic for today is living with ankylosing spondylitis and the signs and symptoms of ankylosing spondylitis. So ankylosing spondylitis. So basically, I'll be just first telling about what is ankylosing spondylitis. Ankylosing spondylitis is the inflammation which affects your spine and the sacroiliac joint. The sacroiliac joint is demonstrated in the image with the arrows. So it will involve the spine and the sacroiliac joint, which will lead to stiffness and pain. It is usually related to HLA-B27. Seronegative arthritis is also part of this. This ankylosing spondylitis is part of a group of disorders known as spondyloarthritis. So again, just elaborating what is ankylosing spondylitis. It is a chronic inflammatory disease which will cause the pain and stiffness in your lower back, hips, and buttocks. Unlike other types of the back pain, the pain and stiffness in this ankylosing spondylitis will improve with the movement and will get worse with the rest. So the prevalence, the prevalence, as you can see in the image, it is most commonly seen in men when compared to the women. And in this image, I'll be telling about where the ankylosing spondylitis involves in the spine. So the first image shows the normal spine where where there is not a normal spine. In early ankylosing spondylitis, you can see the reddish discoloration where the inflammation started in the spine, and further down the course of the disease, after 10 to 15 years down the course of the disease, you can see that fusion of the both spines, which is known as ankylosis. And this image on X-ray seen as bamboo spine, where the spines get fused. So after 10 to 15 years of the disease process, we can see that the patient's posture can change from normal posture to the kyphotic posture. So the causes of ankylosing spondylitis, we have both genetic risk factors as well as environmental risk factors. The genetic risk factors being HLA-B27, it is a gene, and the environmental risk factors being smoking, alcohol, and lifestyle-related stress and other factors. So both the genetic risk factors as well as the environmental risk factors will trigger the inflammation in the spine and the sacroiliac joint and causes the destruction of the spine, leading to fusion of the spine. So this is the basic pathogenesis of ankylosing spondylitis. And the symptoms of ankylosing spondylitis, we have stiffness of the spine, backache, and limitation of the range of the movement of the spine, and fatigue are the symptoms of the ankylosing spondylitis. So the typical patient presenting with ankylosing spondylitis will be the patient with age group 15 to 13 years of age, where the patient will be having ankylosis as the disease will affect the spine, resulting in the fusion of the vertebrae. It leads to less range of movement of both the neck and the spine. So basically, it involves the axial spine. So the axial skeleton, the axial skeleton includes your spine as well as your spine and the sacroiliac joints. So it usually involves the axial skeleton. So there will be loss of normal curve of the spine, leading to changes in the posture, and there will be a fixed bend forward position in the patients after a long course of the duration of the disease. As the disease progresses, it often leads to difficulty in breathing. So I'll be just telling what are the causes of the low back pain. One will be non-mechanical disease processes, either due to renal calculi, and other is heavy lifting of the objects, and the other thing is trauma and poor sitting posture, and other are arthritis. So in arthritis, we have both. So it is difficult to differentiate from the inflammatory back pain versus the mechanical back pain. So inflammatory back pain is usually seen in patients less than 40 years of age with early morning stiffness, and which will awaken the patients, from the sleep. So these are the features of inflammatory back pain. Whereas the mechanical back pain usually caused by trauma, which will be relieved by rest, whereas the inflammatory back pain will be worsened with the rest and relieved by exercise. So when to suspect ankylosing spondylitis in patients with chronic back pain, which is lasting for more than 3 months, and having one of the parameters with insidious in onset, which is waking him in the night from the sleep, predominantly seen in men, improvement with the exercise, and with no improvement with the rest, then we can suspect ankylosing spondylitis. So the ankylosing spondylitis affects the life of the patient in varied ways. It decreases the quality of life and decreases the professional work efficiency. It will cause anxiety and depression to the patient, inability to perform daily activities independently, and decrease attendance to the social activities. So additional features as ankylosing spondylitis involves the spine and the usually involves the spine, which are known as articular manifestations. It also have some sort of extra articular manifestations. The most common extra articular manifestation being uveitis, which is seen in about 30 to 40% of the patients. And we have in this spondyloarthritis group, we have other disorders known as enteropathic arthritis when it is associated with inflammatory bowel disease. And we also have psoriatic arthritis where the patients will be having psoriasis skin rashes along with the peripheral arthritis features. And in patients with psoriatic arthritis, we can see dactylitis and enthesitis. Dactylitis is usually involving the fingers, and enthesitis is usually involving the ligaments. So these are the images showing enthesitis and peripheral arthritis involving the knee, and the eye involvement in the form of redness of the eye, which is uveitis, and the skin lesions in the form of psoriasis. So these are the extra-articular manifestations of ankylosing spondylitis. And why is there a delay in diagnosis of ankylosing spondylitis? There is delay in diagnosis of ankylosing spondylitis because there is delay in presentation to the rheumatologist, and the X-rays do not initially show sacroiliitis in the early stages, and there will be a varied presentation in women and a lack of a specific test to diagnose the disease. And the markers of inflammation, which are like rise in ESR and CRP, are non-specific, and specific genetic marker HLA-B is HLA-B27, but it is not sensitive. So for diagnosis, we need clinical examination as well as blood test to check for the rise of the inflammatory markers, CRP, ESR, CBC, liver function test, and renal function test, and the genetic test of HLA-B27, and X-ray of the lower back to look for symptoms of sacroiliitis, and MRI is useful in early stages to detect the sacroiliitis. So the treatment, there is no definitive treatment, but it can be controlled. The symptoms and progression of the disease can be stopped if it is diagnosed and treated early. We'll give calcium supplementation, vitamin D supplementation for the arthritis part. Mainly three types of three drugs are used for treatment. One are non-NSAIDs, which are anti-inflammatory drugs. The examples of NSAIDs are naproxen, celecoxib, and indomethacin. And other disease-modifying anti-rheumatic drugs are methotrexate and sulfasalazine. And the newer drugs, which have now changed the course of treatment in ankylosing spondylitis, are biologics, where we have anti-TNF therapy with biologic drugs such as infliximab and etanercept, and adalimumab, golimumab, and tofacitinib. And another newer therapy is targeting the anti-interleukin 17, which is secukinumab. So if there is fusion of the joints, we can go with the surgical correction and named as osteotomy or hip and knee arthroplasty. Physiotherapy, it plays an important role. It should be started as early as possible for all the range of movements, and breathing exercises should be done. Home exercises and group exercises should be encouraged, and strengthening exercises and cardiac exercises should be done. Posture training is important for sedentary modern lifestyle. And yoga therapy for 20 to 30 minutes is essential for patients with ankylosing spondylitis. So the precautions to be taken for patients with ankylosing spondylitis, as they have a fused immobile rigid spine, which is more prone to collapsing and breaking easily, they should be taken care not to fall down, and modify the surroundings in the house and take care at night. The other precautions are, while traveling in the car, we'll advise to put a seat belt, avoid smoking and alcohol, and maintain weight according to the BMI. And there is no specific dietary restriction for patients with ankylosing spondylitis, but we recommend exercise 30 to 40 minutes daily, with stretching and strengthening exercises is mandatory for patients with ankylosing spondylitis. Is it possible for the patients to live with ankylosing spondylitis? Yes, it is possible. So they have to just take the support from the family, friends, and counseling plays an important role in ankylosing spondylitis. And we have to encourage them in participation of social activities, and encourage them to participate in professional and office spaces and join the ankylosing spondylitis support groups if the patient is not included in the ankylosing spondylitis support group, and talk to your rheumatologist so that he'll guide you regarding the treatment and as well as the physiotherapy part and the yoga. So from the rheumatological perspective, the ankylosing spondylitis is to be diagnosed early and can be treated early so that it will not it will give eventually a normal lifestyle to the patient. So ankylosing spondylitis is a treatable disease if it is diagnosed early and a proper treatment is taken. And yoga therapy is essential for mindfulness and meditation. Can the ankylosing spondylitis patients get married? Yes, they can get married. It does not directly affect the reproductive system either in males or females. Definitely, they'll have a normal and healthy life. Ankylosing spondylitis in patients with like ankylosing spondylitis and pregnancy, it is less common seen in women. Usually in women with ankylosing spondylitis, pregnancy is usually uncomplicated and the babies are completely healthy. Both mother and child can lead a normal life. So it is usually hereditary diseases are transferred from one generation to the next generation. However, this HLA-B27, it can be transferred from one generation to other generation, but its expression is different, and various environmental risk factors together with the genetic expression only will cause the disease in susceptible individuals. So once the diagnosis of ankylosing spondylitis is made, the patients can have flares where the inflammation rises due to either infections or failure to take if the patients are not taking the regular treatment or having sedentary lifestyle, and if the patient is a known smoker, they'll usually go into a flare. And once if the patient takes the medicine regularly, they'll go into remission. But relapses are also common with treatment. So we'll avoid the patients to do heavy lifting and frequently bending forward and maintain a good posture. Thank you.